We're going to focus on the worrying increase of cancer diagnosis among under 50s. Between 1990 and 2019, the number of cancer cases in people under 50 is said to have risen by almost 80%, according to an international study published in 2023 in the British Medical Journal. The rates of stomach cancer has been particularly increasing among under 50s. Delana D'Souza has this report.
It was 2 years ago when, out of the blue, this 39-year-old was diagnosed with colon cancer.
It was a surprise. It doesn't run in my family. I was in good health.
Today, Emily Thirion is in remission, but like her, more and more young people are being diagnosed with gastrointestinal cancer, including colon, pancreatic and liver cancer. Gastrointestinal cancer rates have been on the rise in patients under 50 and the causes remain unclear. In the past, the increase was attributed to obesity, tobacco and alcohol intake. However, new tests are being conducted to find out what could be behind the recent rise. Experiments are underway using hair, fat and blood samples collected from 300 colon cancer patients.
We're looking for toxins in foods, everything that may have contaminated it, like packaging. We also check for traces of antibiotics.
Gastrointestinal cancers account for a quarter of all new cancer cases and a third of cancer deaths worldwide.
We're going to talk more about this now and bring in Jonathan Fisher, who's an associate professor at UCL, and his research focuses on immunotherapy for solid cancer. Jonathan, thanks so much for joining us on the program. So age and worrying and growing older is a top risk factor for cancer. What, in your view, is driving this increase in stomach cancers among young adults?
So I think there are a few things which are contributing towards this. There's, for a while, been some quite good evidence to suggest that it's related to increased consumption of highly processed foods, a more kind of fast food based diet as opposed to more natural fruit and vegetable based diets. This may have driven the increase in the US and in the UK, but clearly this isn't the only factor. And I think it's really important that more research is going on to determine exactly what the driving causes of this increase might be.
And we know that cancers aren't common among people between age between 20 to 29. So there aren't many widely recommended screening tests to look for cancer in people in that age. Does the industry need to sort of revamp and do more to provide methods, make them more available for people to get diagnosed?
So I think improving screening programs and also improving people's education about what they can do to help reduce the potential risks would both be really helpful. So to give an example, it's now widely accepted that smoking and lung cancer are connected, and we've seen a drop in smoking rates in a lot of countries. I think if we can increase people's awareness of the fact that consuming a highly processed diet and so on may increase your risk of gastrointestinal cancer, then maybe we can help people not only prevent things, but also help pick things up so that then they can go and seek additional medical attention if they start feeling unusual symptoms and know what to look out for.
Well, let's stay with prevention. Give us more advice on how we can prevent cancer developing in ourselves. You mentioned diet, you mentioned smoking. What else can we do to prevent cancer? So
I think, avoiding things where there is a good level of evidence that links those things to cancer. So for instance, to start from the outside in, making sure you use good quality, high factor sunblock when you're out in the sun. We know that can reduce risk of skin cancer. As I said, we've already discussed smoking. I think trying to ensure that you have a diet that is rich in fruit and vegetables and fresh food, as opposed to highly processed fast food or ready meal based food with a lot of extensive industrial production processes that have gone into it. I think maintaining a healthy body weight is really important. There are a lot of links between cancer and obesity, and in general, staying active and well, I think are the sort of things that people need to do. We're seeing a trend in recent years of increasing body weight and more sedentary behaviors, because work is now something that we largely do sat down. People sit down a lot more now than they maybe did 50 years ago.
Yeah, for sure. Many of us not getting our steps in, our daily steps in. Jonathan, talk to us about whether there are any good news here. We've talked about the worrying increase in cancer among people under 50. Are you seeing any promising progress in research, in understanding and treating cancers in younger people?
Yeah, so I mean, there are a lot of really positive messages as well, from the diagnosis and understanding of cancer all the way through to new therapies that are happening. So to give you an example, I work in a field called immunotherapy, which harnesses the power of the immune system to attack cancer. And we've been seeing some great success in blood cancer using immune cells from patients that have been modified so that they can kill the cancer cells. And now we're starting to see those being used in solid cancers, so in cancers that form lumps. And one of the hospitals in London has just announced a big program to really push this forward for solid cancer patients. So I think we are seeing a lot of promise. There's still a lot of work to be done, but we're now in a position to better understand the disease and to better design specific treatments that are really more thought out to be able to target the cancer specifically.
We got some news today coming out of the UK saying that prostate cancer is the most prevalent form of the disease now in the UK. What would you say is the most prevalent form of cancer among younger adults?
So I think you've got, I think leukemia still comes out as the top as the top ranked cancer. I think then if really beyond that, you have to separate it out into whether you're talking about cancer in the brain or cancer in other parts of the body. So for example, I see a lot of teenagers who have bone cancer, and there's a bone cancer called osteosarcoma, which is probably one of the commonest cancers in teenagers. It really does depend on the age of the patient.
Jonathan, best of luck with the work you do. Thank you so much for joining us on the program and giving your insight there. Really appreciate it.
Thank you very much.